Great. You can see people are coming on one by one here, so we're going to give it just another minute, but I welcome you all to our webinar on injectables. So we're going to cover a lot of different topics, kind of give an overview of all the different kinds of things that are available, and then we'll actually have a patient here that we're going to do a Kybella injection on at the end. As usual per our webinars, I'm going to go through a PowerPoint presentation, but you can also type in questions as they arise, and I'll try to keep noticing when someone has a question. Usually Ashley keeps me in line and fills me in when I'm missing out on some questions. But so I'm open to that during the presentation. I think it can make it more interesting if I know what you guys really want to know about. So we'll get started in just a minute here. I think by my watch it's just 6 o'clock now, so let's wait another minute or two and we'll get going. Hopefully everyone has recovered from our latest blizzard. I know I'm not supposed to say out loud how much I enjoy all this snow, because I know most people in Maine are awfully tired of it. Okay, so our topic for this evening is injectables. We're going to go over the two broad categories of injectables, are fillers and neurotoxins. Fillers to volumize different areas of the face and body, and neuromodulators, which are used to relax muscles. Those are the kind of two broad categories that we're going to review. The whole plan for the evening is that we'll let you know what you should expect when you're undergoing one of these procedures, what it looks like kind of pre and post procedure, go over what some of the dermal fillers are that we're using in this practice, the available neuromodulators out there, and then we'll discuss Kybella. That'll be our last kind of topic, and then we'll do a treatment here in the office so you can see how easy that is. There will be special pricing for anyone who's watched the webinar, and we'll keep track of that. And at the end, I'll go over what that looks like. And like I said earlier, if you have questions, you can ask them at any time during the presentation. I'll try to keep an eye on what's coming up for questions and go through them as they are applicable to the topics. So what to expect with injectables. In general, this is kind of where people first get interested in the aesthetics. It's kind of attainable during one office visit. Often people will come in for a consultation, and at that same consultation, we can do the treatment. We'll evaluate your area of concern. Depending upon the area that you'd like to correct, there are different options for different types of fillers, and that's what this webinar is about, is to give you information on why certain fillers might be good for certain things. So depending upon your concern, that's how we choose which one we're going to use and how much of it we need. The risks and complications are something that we're going to go over. In general, complication rates are very low. The most common thing that we see in the practice is some minor bruising at the time of the procedure. Of course, we need to know your full medical history before we embark on injecting anything. Want to make sure we know your history, your allergies, your medications, things like that. Most injectables are done with minimal local. We just clean the skin. The needles are very small, and the puncture wound is used to deliver the medication. In the case of fillers, you will be able to see the improvement immediately. So before you walk out of here, you're going to see how we've improved whatever area you've been trying to improve. With the neuromodulators, it does take a little bit longer. Most people have complete response by 5 to 7 days, but to see what you really want to see is really quite prolonged to about 2 weeks in some people. We'll also discuss how long some of these products last once they're injected. The great thing about injectables and fillers is really right after the treatment, there's not much that you have to change about your lifestyle. We don't want you to do, a face down massage the day of a treatment or any high impact exercise, but within a day, there's no reason that you can't get back to a normal exercise routine. Avoiding direct pressure, I would say really the only thing would be a lot of pressure to your face is a massage. And I have had people come in that had an appointment after for a massage, and then it's really not a great time for a filler. We also do this often in conjunction with other aesthetic treatments in the office. So if you came in for a laser treatment or microdermabrasion or microneedling, the fillers can be done at that same setting. In general, we do the other treatment first and then the fillers or Botox second. So So often we're working with the estheticians and coordinating that treatment all at one setting. So we're going to start with a list. When you call to schedule an appointment, we'll let you know that these are all the medications to try to avoid 2 weeks prior to your injection. Avoiding these things will just decrease the chance of you having bruising. If you have bruising, it doesn't change the quality of the injection. It doesn't change the durability of the injection. It just changes how you feel about it. If you walk out of here with a bruise on your cheek, it definitely detracts from the cheek augmentation. Bruising with fillers is relatively common. 40% of people will get at least some type of small bruising. Botox is much less likely to bruise. The volumes are very small and the needles are very small. So less than 10% of the time will someone have a bruise from Botox. But avoiding these supplements and medications can really help decrease that amount of bruising. I'm also a big proponent of arnica. We have these little containers in the office. It's Arnica Montana. It's made in these little tiny sublingual pellets, and if you are a regular in getting injections, you might want to start using this the day before your injection. If you know that you're a bruiser, it can really decrease the amount of bruising that you have. This was actually one of the first homeopathic medications that was studied in mainstream medical literature, and there is definitely a benefit to getting on arnica. Most people know if they're bruisers or not. The reason you want to know this is if you want to get a lip filler and you have a wedding in 3 days, that may not be the ideal time for you if you know that you bruise really easily. It would be something that you'd want to do 2 weeks ahead of time. It's kind of the optimal window for most fillers if you have a big event. So this is one of the things that our staff would let you know about when you call to schedule. And then the second thing is, like I said, is knowing when you're hoping to see your improvement. If there's a specific event, if this is just part of your routine maintenance plan, we want to be able to time it when it fits in with you, so that you can have some tolerance for that bruising. So what are dermal fillers? The most common dermal fillers in the United States are made out of hyaluronic acid. There's also fillers made of calcium hydroxyapatite, and there are other proteins out there that are used for volumization. But in general, the goal of a filler is to add volume. Sometimes it's volume on a deeper level, meaning something structural, like augmenting a cheek or the mandible. Sometimes it's more superficial. People who have really superficial fine lines and wrinkles of an upper lip or around the corner of the eye. Sometimes people get superficial wrinkles of the lateral cheek. And depending upon what the area of concern is, we have a whole variety of fillers to use. And how the fillers change is by how much they're cross-linked. The more cross-linked they are, the thicker and more durable they are, and the deeper we're injecting them. The ones that are more superficial are so that we can get into those little fine lines and wrinkles without creating any disturbance in the structure. The fillers in general that are the thickest go the deepest, and then the thinner ones are injected more superficially. Along those same lines, the ones that are injected more deeply tend to last longer. There's less mobility rate over the bone, less metabolism than if you're putting a filler on the surface of the lip or an area that's very mobile. In general, the great thing about hyaluronic acid is the protein that all of us make. We have it in all of our skin already. The body doesn't recognize it as foreign. It's a protein that we make, which makes it very safe. The good and the bad about that is that we also have an enzyme called hyaluronidase that breaks down that protein. That's why they're not permanent. As soon as it's put in, your body notices, that you have this protein, just like the protein that you're making on a regular basis. You're making it and breaking it down, making it and breaking it down. The extra hyaluronic acid is still going to get broken down by your body eventually. And for most people, this is what makes it such a great filler, is that it's a natural protein. The chance of having allergic response is very low. And then the fact that it's not forever actually makes a lot of sense to me. There's been times in the past and in some other places where silicone has been used for a filler. And the problem with something that's really permanent like that is that our faces are constantly changing. The aging process is constantly going on. With the hyaluronic acids, we can kind of just adjust it as we need to in the places where we need it appropriately, rather than having something that could end up in the wrong place as aging goes on. One of the other more common fillers is calcium hydroxyapatite. The brand name of the one that we use in this office is Radiesse. It's something I've been injecting for more than 10 years. Calcium hydroxyapatite is a protein that has been used in medicine for a long time. And when I was a craniofacial fellowship, this is what we use to help grow bone in young children with craniofacial deformities. So the track record of safetiness has been there, but what we know about it is that it actually stimulates collagen production. So this filler is a little bit different in that it is not an endogenous protein or a protein that we make on our own, but it is something that stimulates us to make collagen. With the Radiesse filler, you see the improvement with the filler right away, but because of that stimulation, the collagen production goes on and on and on as you're kind of eating up that protein and laying down new collagen. So it's quite durable and has a good stimulatory effect on the collagen. And we also have found over time, by using more and more fillers, that all of these things, although they are meant to augment volume, they do improve the skin quality overlying these things as well, because you're stimulating all these factors that help generate new collagen. So as someone who's had a calcium hydroxyapatite injection, not only do you see the volumization with improvement, but it also improves the surface quality of skin. So a little bit more about fillers. Where are all the places that we can use them? Almost anywhere on the face, depending upon the concern. Sometimes we can use them for augmentation of areas around the nose. This has been a way to avoid rhinoplasty for some people if there's a dorsal nasal deformity. Sometimes for scars, and then for aesthetic lines, so marionette lines, smile lines. The most common areas for volumization are cheeks, lips, and temples. As we age, we lose volume all over the place, but those are the places that concern people the most. They're helpful for vertical lip lines, and this would again be one of the thinner fillers that would use in this area. They can enhance the lips. I'd say most people who come in here for a lip injection, nobody really wants to have gigantic, enormous lips. Yes, there's some people who want them, but the vast majority of people just want things to look fuller and smoother. So the goal really is to kind of enhance the area and smooth it out and not make things gigantic with fillers. It can also be helpful in the chin crease, the area below the lower lip, or sometimes people have lines like in the corner of their mouths around here. It's a great place for a filler. Symmetry in faces. If you look at any of our faces, there's always one side that's different from the other based on our activities, how we sleep, what our sun exposure has been. And when I am doing a filler on a patient, it's my job to notice and to be able to point out and show you what the differences are. And it's not abnormal. Everybody has it. I know I might have my flat side and my full side. We all have a big eye and a small eye. The reason to notice it ahead of time is if we're doing a cheek augmentation, I can't just do a cheek augmentation and say, okay, we're going to use 1 cc on this side and 1 cc on this side. It's really important to look at the face really in a dynamic way. And that's part of the consultation, is as I'm talking to someone, I can see how they animate and where I feel like I can help them the most with augmenting a certain area. So it's not always, there's not a cookie cutter way to put a filler in. It really depends what that specific face needs and the patient's concern. Radiesse is the filler that we just mentioned that is calcium hydroxyapatite. It's great for volumization, temples, cheeks, mandible. It's also recently become FDA approved for the correction of volume loss in the hands. The hands, we always say, are the giveaway of your actual age, because most people who are concerned about aging are using sunscreens and kind of maybe taking care of their facial skin, but not necessarily taking care of the backs of their hands. It's an area that's often missed by sunscreen, but certainly high exposure. So this is a great way to fill up that volume. It helps decrease the appearance of veins and tendons, and again, it also helps the restoration of the skin, the collagen in the skin, so the skin quality improves after that type of an injection. And this is just an example of some of the dermal fillers that we're talking about. These are made by Allergan, all hyaluronic acid and basically different thicknesses. Voluma is the thickest that they make, and it's usually used for cheek augmentation for this area of the mandible. Those are, in my practice, the two most common areas are here and here. And you can see after one syringe, there is pretty minimal improvement. There's some improvement, but if you can imagine one cc of a syringe, I can show you what a 1 cc syringe looks like. And I'm actually going to put my tea in it so you can see what the volume looks like. But this is 1 cc, and 1 cc really isn't that much. If I put it on my hand like that, that volume isn't a ton. So it's just kind of enough to make everything a little bit smoother. So often with a cheek augmentation especially, we need more than 1 cc. Often for a lip, 1 cc is plenty to make things plumper and smoother, but for really volumizing a face, it can sometimes be 2 or 3. And this patient has had 3 cc's of Voluma in her cheeks here. After they filled her cheeks, the nasolabial folds were filled, as well as the marionette lines, the lip lines, and the lips themselves. So that's using kind of all of the materials from the thickest to the thinnest in various areas. And you can see with, using a few different modalities to address different concerns, you can really give the whole face a much more youthful appearance. Radiesse, as I mentioned, is kind of the gold standard for volumizing hands. It just makes the hand look more youthful if you can't see, every vein and tendon in the area. Again, it's something that's done relatively quickly in the office. There's no limitations of activity afterwards, and it's quite durable. Radiesse lasts 12 to 18 months in most people. So what are all these things that we're trying to address with fillers and with neurotoxins? And we'll get to the neurotoxins next. In general, I think of the neurotoxins, neuromodulators, the ones that people are familiar with. The names are Botox, Xeomin, and really the most applicable place to use them is for the upper third of the face. We're really not focused on volumizing, except sometimes in the temporal area, really just trying to relax the muscles in these areas. Occasionally, if someone has a very strong muscle, either of the lower lip or a very short upper lip, Botox can be super helpful in improving the smile and some of those lines of the upper lip. But in most patients, it's used for the upper third of the face. So tear drops can be injected. There's one of the newer, thinner products is called Volbella, and that can be really a nice correction of the tear trough area up here. Again, for me, in this area here, to volumize the cheek, I would use Voluma or Radiesse. Similarly for the temple, Voluma or Radiesse. And then marionette lines, the lines down here in my hands is usually Juvederm or Velour. Velour is a little bit thinner than the Voluma and a little bit thicker than the Volbella. And so for these areas, it's great for augmenting the corners of the mouth. This is, I think, an under-treated area in a lot of people. Going straight for the lips can make this smooth, but treating the area around the mouth can really help upturn the corners of the mouth, which is nice and youthful. Plumping the lips is another common area. And again, these different fillers can be used. In our practice, it's usually Juvederm, Volbella, Velour. We're also doing fat injections now in the office, and the lips can be augmented with your own fat as well. Hands, we mentioned I would use Radiesse for that there. This area of concern here, the nasolabial fold, is well addressed with Juvederm and also with Volbella and Velour. Again, in someone who really has deep nasolabial folds, I would also address the cheek. If we just go for each little wrinkle, it doesn't necessarily improve the overall aesthetic of the face. So my job is when someone comes in to understand what the primary concern is, what the secondary concern is, and then kind of balance the face and the treatment based on their desires, and then where we can kind of get the most out of whatever filler we decide to use. The thinner fillers are also helpful in treating acne scars as well. Often, if someone has really significant vertical lip lines, we would use this in conjunction with lasers and with peels and things like that. So I think of fillers and neuromodulators as just part of kind of the rejuvenation effect. If you look at kind of the outside skin, the superficial skin, the deeper skin, the subcutaneous tissue, we're kind of addressing things on all different levels. And the more that we address all those different levels, the better everything's going to work. So this is just a picture of Juvederm and Velour. These proteins actually are lasting longer than the kind of the first version of Juvederm, but still high hyaluronic acid, still high safety record, low complication rate. Like I said, the biggest problem we've ever seen is just some bruising at the site of injection. We haven't seen any allergic reactions to the hyaluronic acid fillers. Let's see if I can get this slide to go next. Oops. So now on to neuromodulators. How neuromodulators work basically is by preventing the nerves and the muscles from talking. So it doesn't injure nerves, doesn't injure the muscles, but it does block those two things from communicating. So it sits on the receptor so that the impulse from the nerve isn't getting through to that muscle fiber. Why this is great is because over time you can really train your muscles if you're not, using them in a similar fashion. I use myself. I haven't had Botox for 4 months, and I still have a pretty relaxed muscle. But I've been using, neuromodulators for probably the last 8 or 9 years. Using things over time, you can kind of train your muscles to work how you want them to work and not how you don't. One of the original people who did studies on kind of the original neuromodulator treated his sisters for a few years in a row without ever letting them recover completely. And he shows photos of them now, and they still look more youthful than they did 10 years ago because those muscles have just learned to be smoother. So it's a safe way to reduce frown lines. Most common is this area here, the glabellar area, which is now known as the 11s. That wasn't a term that anybody used, 20 years ago. People weren't concerned about their 11s, but all these things have common language terms at this point. So the areas, that's the most common area. Also forehead lines, crow's feet, and it can also be used for neck cords. Some people have prominent muscle bands of the neck. It's useful in that area. And like I mentioned, areas around the mouth, if someone has some asymmetry or some muscle activity in this area or a very short upper lip, it can be helpful in improving the aesthetics of a smile. In my mind, the place that it's most underutilized is actually around the eyes. And it's not so much that there's anything wrong with crow's feet, but in treating that area, it really opens up the aperture of the eye. So it helps elevate that brow and just give a more youthful look and more exposure to the eye area. And it doesn't take a lot of Botox to do it, and it really nicely opens up that area. So there are a couple different companies that make this. Botox is the one that most people recognize. It's been the most widely marketed. But there are multiple very safe and tried and true FDA-approved products for neuromodulating. We use Botox and Xeomin in the practice. Sometimes people respond to one better than to another. The one purported advantage of Xeomin is that it's a more purified protein, so there's less likely that someone will become immune to it or develop antibodies to it. They both really start to work in the first week after injection. At the time of the injection, you may have a little, pinpoint little area of swelling just from the extra fluid that's in there, and that usually disappears within the first hour and a half. And over that first week is when you kind of start to see the medication working, and it happens slowly over time. So it's not one day it's not working, the next day it is. It's kind of gradually things are getting softer and softer and softer, and you'll be trying to knit your brows together, and can I, and then eventually you can't. In some people, if they have very deep folds in any of these areas that we're injecting, will be able to see that the area is no longer dynamic, meaning they're not able to create that crunching motion. So we know the Botox is working, but sometimes it takes folds that haven't been treated. You know, if someone's in their 60s or 70s and it's the first time they've had Botox, it takes a longer time for those surface lines to disappear. So although we can see that it's smoother, it can take longer in an older person to see the positive effect. Occasionally, if the folds are really deep, we can add a filler in underneath the Botox. Why I would Botox first is if the area is super, super dynamic and you put a filler in, it's just not gonna last very long. So if we know we wanna relax it, we would treat it with the Botox first, get the area relaxed, and then smooth things out if the wrinkles are stubborn and require a little volume to plump them up. In general, the neuromodulators last 3 to 4 months. Some people are super lucky and they last 6 months or longer. We tell people to expect the 3 to 4 months. And I always say that the time that people really appreciate the Botox the most is when it starts to wear off. Because it comes on gradually, you kind of forget that things are looking better and better and better and better. And then when it starts to wear off, you're like, oh yeah, was it like that before? So you accommodate to the smoother look really quickly. And once it starts to wear off is when people are like, oh my gosh, I love that stuff. It really made a difference for me. So that's neuromodulator. This is an example of a patient who was treated between the brows and around the eyes. And you can just see, it's not that these lines are so bad, it just looks softer and smoother afterwards, and her brow position's a little bit higher. So it's a great way to just kind of smooth things out. And like I said, one of my favorite things about it is the way that it opens up the aperture of the eye. Kybella, and this is the thing that we're going to show you tonight. And I don't know how many people out there have heard of Kybella, but basically it's deoxycholic acid, and the term mesotherapy has been around for a long time, and these types of things have been injected to help melt fat all over the body, kind of all over the world. And what this company has done is took Kybella to the FDA to get approval for reducing fat in the submental area specifically. That's the FDA approval for this medication. We know that it works. Like I said, people have been using it around the body forever. But it was super smart that they were able to get FDA approval for it so we could really prove the safety record for it. It helps remove the volume. It's injected just like other things through a small needle. The volumes are small. The treatment itself, we'll show you. First we ice the area, and then I'll put actually a tattoo on our patient's face, and you can see these little dots here. And I know exactly how much of the medication I need to use per dot. And you can see from this thing that this doesn't fit everybody. It's not one size fits all. It's, looking at where the excess fat is and where we want to absorb it. We don't want to get rid of fat that we want to keep. After the tattoo is placed, it's kind of like the tattoos that used to be in Cracker Jack boxes. It just goes on with water. The medication goes in with the needle, and then we ice. The needle sticks themselves are really not terribly uncomfortable. The medication does burn a little bit, and that's the reason for icing right away. At the time of the treatment, you'll see things will just look a little fuller in that area. You'll see some swelling. You'll be able to see where I put the volume in. The beauty of how this works is it just starts to liquefy that fat, and then your body absorbs that fat and processes it over time. The first week or two after the treatment, there's some bruising and some swelling. It's a little harder to do to people in the summer. In the winter here, especially this winter that we're having that's lasting forever, it's pretty easy to wear a scarf for a week or so while you're absorbing that extra volume. But it does look worse than the starting point for the first 2 weeks. And at about 2 weeks, people look pretty much like they did before the injection. And then it's from there that the improvement, that we see the improvement. Occasionally people need 2 or 3 treatments, and it really depends how much volume of fat there is. So it's a patient by patient basis, mapping out exactly what we need to treat that area. I like to wait at least 2 to 3 months before giving someone a second treatment because of the absorption that happens and the improvement that I've been seeing in the skin. So we don't always know how many you're going to need, but a lot of our patients are really happy after just one treatment. This is an example of a male patient who had it, and and you can see in the middle of the treatment things kind of look a little bit worse. Things are a little fuller. You've kind of lost some of the definition that he did have, and then after he's healed and it's all absorbed, the jawline and submental areas is vastly improved. This is the pricing benefit for this evening. There's a group of handouts on all of these topics, so you can see what the instructions are that we provide patients for their treatment, and hopefully you can see how to get those on your screens. But it's nice to know ahead of time, you know, what it's going to look like and what to expect. So these are the pricing for attending the seminar, and now I'd be open to questions, and I'm also going to bring our patient in here so we can get things started with the Kybella injection. But if there are any questions, now's a good time. And anything that you want to know, anything you've heard about fillers or neurotoxins. I would say the one thing to bring up is every once in a while there'll be someone in the news who's had something crazy happen with what is described as Botox, and it usually wasn't Botox. There's all sorts of people that are injecting all sorts of things, and it's never going to be a board certified surgeon who has these types of problems with Botox. I'd say it's people who are getting things on the black market for less money, and you don't know where they actually come from, and the complication rates for Botox are incredibly low. The most common thing that's reported is ptosis of an eyelid, which means that an eyelid gets lowered, and that's just something we haven't seen in our practice. We're very precise with the injections. We know exactly what we're looking for a response from the injection. So I'm going to introduce our patient, Sarah. She's going to sit right down here next to me. I'm going to make sure you can see her and me, and I'm just going to go through what she and I have talked about in looking at her area of concern, and then I'll show you exactly how we do it. And you'll see it doesn't take the whole thing, won't take very long. I'm just going to step over here and wash my hands, and then okay. So when Sarah and I talked about using this, her area of concern is right underneath her chin right here. And what I'm looking at is there enough volume that I feel like there's room for that fat to be absorbed? And is her skin healthy enough? You can see she's got really nice, young, healthy skin, and it will conform to that change in volume. So the goal is just to lessen the volume right in this area here. So we place our tattoo. And this just helps. I'll get you in a more comfortable position in a second. This just helps me know exactly where I want to place it so that I make sure that I'm getting the right volume in the right location. And I've already marked this out ahead of time, so I've drawn up the exact volume that I need for her treatment. I'll go to the other side after I get this on her. This literally it's just water, and it just helps. I got it all over your shirt too. It's just a work shirt. It'll be fine.
Yes. Just water.
It's just water. So I'm just waiting for these dots to come off on her skin. And she's been icing probably for the last 10 minutes. If someone's very concerned about pain, you can always come in earlier and have some topical, local. We'd use a cream with some numbing medication in it, but really you'll see it's really tolerable for most people. We haven't needed to use very much for the local. These dots don't want to come off tonight.
Yeah, they should come off.
Yeah, they usually come off really easily.
Yes.
You're not sticky. Okay, so I have enough of a map here to know. put your legs up so you can relax a little more. Our production manager is moving the camera around so you can see everything. Are you reasonably comfortable?
Yes.
Okay. She's gonna just do her yoga breathing and relax. So I'm just gonna clean off her skin here with some alcohol. And yeah, what you can do is take the tops off, and then you'll just hand them to me one at a time. All right, okay, here we go. So I'm getting all the areas that I've marked. And it's not important for everyone to know what volume we're using in here, but there's a specific volume that's required for each location. And that's why the company came up with the map, the tattooing, so that we know what we're delivering and where we're delivering it. Different than almost all the other things that we just talked about, in that this is just about getting the medication in the area to absorb the fat. Whereas other things that we use, obviously, we're very careful about putting it in the exact location for volume. Almost done. I'm gonna stop right there. So we completed the injections. We had a technical problem. We're kind of heated at the moment. And we're talking about, I don't know if you could hear that, but it just stings a little bit. The actual injections, interestingly, the needle sticks, even with fillers or with Botox, it's actually the fluid going in more than the small needle. The needles are tiny. It's a 32 gauge, really tiny stick, but the medication does burn a little bit. That's why she's, breathing calmly and icing. The ice makes it feel a lot better.
Yeah.
And this will kind of resolve over the next hour and a half. Like, she's not going to, stay, inflamed all night long, but it is a little bit burning at the beginning. So she can ice, she can take ibuprofen and Tylenol alternating if she needs it. Sometimes we give people a little bit of a compression garment, which just helps get the swelling out of there quicker, and that can be worn just at night. It's something that's pretty unsightly to wear during the day, but it can help the swelling resolve a little more quickly. And like I said, over the next 2 weeks, it'll look fuller than before the injection, and then in 2 weeks we'll start to notice a volume reduction, and we'll be able to show the photos of before and after for her. And then at 2 to 3 months, we decide if we want to augment that in any way and get rid of anything extra. I think you're going to be happy with just,
I think so.
yeah. That's it. So we can see we lost most people when we lost our feed there. But we gave her the rest of her injections, and now she's icing. We were just talking while we were offline about what it actually feels like. And Sarah said it feels more like a throbbing rather than a burning sensation, that the needle sticks are actually minimal. It's the kind of the response to the fluid itself. So the time it felt the most intense was maybe 30 seconds after we were done, and now it seems to be dissipating. Yeah. So sorry, we went offline at just the wrong time, but we actually recorded some of it on her cell phone, so she'll be able to forward that to people who are interested. And I think that's it. And any questions also we're happy to address via email because of our small technical problem. And it was bound to happen, right? So I hope that you all are, again, safe in the storm and that you'll join us for our next webinar. Thank you very much.